Hello, my name is Luke, and this is a response to Dr. Kimball's post about dual relationship. So first of all, a dual relationship is created whenever the role of a counselor is combined with another relationship, which could be professional or personal. So professor, supervisor, employer, friend, close relative, or a sexual partner. Those would be examples. And then Dr. Kimball also asked, why are dual relationships such a problem in the professional counselor's practice? Well, the short answer is that they cause confusion and interfere with the counseling process. And from a value standpoint, they may restrict the client's autonomy. They may not be in the best interest of the client, and they could potentially cause harm to the client. Then we are to choose one of the three questions at the bottom, and I chose number 1. In the more recent 2014 revision of the ACA Code of Ethics, a number of changes were made around dual relationship. For a follow-up post, answer the following questions. Number 1, what does the ACA Code of Ethics say about managing boundaries in professional relationships? Well, the ACA is rather blunt. It basically says that, this is sexual relationships, for instance, are prohibited, with the only exception being the section A5C, where it says a romantic relationship or romantic counselor-client interaction with former clients, their romantic partners, or their family members is prohibited for a period of 5 years following the last professional contact. So after that point, it would be allowed. However, the same rules would still apply. Counselors are to consider the risks and benefits of extending current counselor relationships beyond conventional parameters. And so a lot of this whole area, just like many areas in ethics for counseling, is left up to the judgment of the counselor. And so we just need to consider the most important thing, which is the wholeness and wellness of the client, and whether what we engage in, whatever relationship we engage in, is helpful or harmful to the client. And then her last question is, what does the following article say? And then there's a link to an article called Dual Relationships, a Continuum Ranging from the Destructive to the Therapeutic. And the article is very good. It is pretty exhaustive, talking about all the aspects of dual relationship. And it does mention that there are some times when the dual relationship may be unavoidable, such as in a small town or rural setting. It may not be possible to completely have a separation between the counselor and the client, or at least those who are related to the client. For instance, one example is perhaps the counselor and the client would share their children would share a teacher, or there would be some other times where they would interact. So that's one possibility. And then also, it is possible that in fact there are therapeutic dual relationships. And so towards the end of the article, it talks about how sometimes the avoidance of a dual relationship could actually be the harmful thing, or cause undue attention to that delineation and cause the client to feel uncomfortable. So again, it revolves around judgment call. The last, near the bottom of the article, there is some recommendations to prevent or to keep in mind when considering dual relationship. And so I thought I would share those, and because I thought they seemed very helpful. So here's the list of things to consider. Number 1, set healthy boundaries from the outset. Number 2, secure the informed consent of clients. Number 3, remain willing to talk with clients about any unforeseen problems and conflicts that may arise. Number 4, consult with professionals to resolve any dilemmas. Number 5, seek supervision when dual relationships become particularly problematic or when the risk for harm is high. And 6, document any dual relationship in clinical case notes. 7, examine your own motivations for being involved in the dual relationship. 8, when necessary, refer the client to another professional. So I think that's a pretty logical flow of how I would consider a dual relationship, and so I hope that is helpful. Thank you for listening, and God bless.